It's Healthcare Heartbeat, and for you returning listeners and viewers, you may be saying, hey, Ross is not in the normal studio. No, I'm not. We're getting some work done there. But that's not going to stop me from talking to you about all the amazing things that Global Impact has been up to.
You're listening to Healthcare Heartbeat, brought to you by Avant Healthcare Professionals.
It's Healthcare Heartbeat and a really exciting episode because once again, we are marching base with Global Impact. And whenever we do that, I am joined by Christina Khan, Director of Strategic Partnerships and Global Impact. Hey, Christina.
Hey, Ross. Great to be back.
Yeah, it's weird this time because we're like back, but we're not in our studio, you and I, right?
Yeah, I'm not sitting right across from you, but
No,
it feels like we're here still together in spirit.
It does. It absolutely does. Having some work done on the studio, but we did not want to miss a very important global impact update. We try to do these every quarter, and there's been a lot to talk about. Now, for those of you who are maybe just getting introduced to global impact, Christina, why don't you talk a little bit about what is Avant Healthcare Professionals Global Impact Initiative?
Sure. So Global Impact is our way to give back in meaningful ways to the communities of our healthcare professionals, the communities that they call home. And so we, through Global Impact, work to improve access to education and healthcare around the world. So through amplifying the efforts of local organizations, working with community organizations that are already embedded in the communities doing this impactful work, we're able to support their initiatives and help them reach a greater impact. We also do a lot through scholarships and supporting the next generation of healthcare leaders.
Yeah, global impact, as we talked about before, we'll talk about again. It's really about amplifying existing efforts and figuring out opportunities where we can really, get improved awareness and improved just health care knowledge and actual help. Now, this has been going since when? Global Impact. How long has this been around?
Officially since 2023, so we've been at this for a few years now.
Yeah, and so done a lot. We've covered it in previous episodes, but what are some of the highlights, or what are some of the types of things that we've already done in the previous year and a half?
Goodness. Well, we have the Dream Become Inspire Nursing Scholarship, where we help promising nursing students who have some financial need cross the finish line to finish their nursing degree. We cover their tuition, we provide a monthly stipend, leadership development, community service opportunities, mentorship, all to help them achieve their dream. So that's one of the big things that we do. We also work with community organizations across the world, around the world. So some things that we've done recently that we've talked about in a previous episode. We worked with the Abyssal Township Comprehensive School in Kenya, where we were able to work with the school leadership to construct brand new classrooms so that the learners there can dream big and thrive. We work with community organizations both in Kenya and the Philippines to provide healthcare access to people who might not otherwise have it. So this is through medical missions, medical camps that involve so many of Avant's volunteers, whether they're our nurses or our scholars or even our corporate staff who have been able to come out to support these initiatives. We've done a lot of other things too, but I know we've got some cool things to talk about today.
Yeah, that is definitely just hitting some of the things. Now, the last couple months, really, it's about a return to doing some work in the Philippines. Is that correct?
Yeah, we came back to the Philippines and can't wait to share with you some of the cool stuff that we got to do there.
So it's been about a year since we were in the Philippines last. Is that correct? At least with Global Impact?
Almost to the day, a year.
Really?
So, yep.
Okay. So that's the one of the things that y'all brought to the Philippines, and again in the last couple of months, is a mobile clinic. So do you want to start and maybe talk about that event and what that was all about?
Yeah, so we work with this amazing organization that's based in Metro Manila called Child Hope. And Child Hope runs several different programs that support children in street situations throughout Metro Manila. One of those being the Clinicalier. So, this is a program that we've supported for the past few years. But on this particular day, we brought our Avant volunteers and we came out to support the Clinicalier event. So basically, the mobile clinic goes and sets up, and there's health education, there's fun for the children, but also they get to have their medical needs met at the mobile clinic. And that's getting medicines, getting supplements, talking with a social worker, everything that they need to thrive.
One of the things that you had told me about around this event was this concept that they also do like a story time. Is that correct? Right?
Yeah, it's part of the health education. So our Avant volunteers got to read some storybooks that are all about health, different health themes, and then to take it a step further, our Avant volunteers had the children actually act out different health scenarios, and they had such a blast with it. So the kids are so creative, and they got to bring their creative touch to their skits to act out these different health scenarios while still learning about important health topics.
I think that's just really awesome, particularly when you're working with kids. Like if you can find that way to make this topic engaging, to make this topic I get creative, right? To kind of tap into their creativity. I feel like then the takeaways and the lessons just are that much more impactful.
Absolutely. And you got to make it fun. You got to keep their
Yeah.
engagement. You got to keep their interest. We're competing with, social media and all these things. Like you need to have it be fun and engaging. And the children actually, they had a blast. They're so creative. They worked with each other to create these skits, and were, talking amongst themselves of like how they're going to be better than the next group. And it was a lot of fun.
Now, on that same day, there was also another event, a Healthy Heroes, right? With that young focus.
Yes. So Young Focus is an amazing organization also based in Manila and in Tondo. And so they work to help children and young people who have had to drop out of their education, whether due to poverty or other life circumstances. They help them catch up, get re enrolled, and finish their education and really lead meaningful, fulfilled lives. They do so many different things, but that's kind of the heart of it. So we had this event we worked with Young Focus to do called Healthy Heroes. So we brought in our Avant volunteers, and it was all about the different dimensions of health and wellness. So we like to say, like, if you have a body, health matters. And we all have a body, so of course, health matters for everyone. And so we talked about a couple different things. So we had an age range of students from about 5 to about 16. So wide age range. But we talked about different things like hand hygiene. We introduced students to an exciting career in healthcare. They got to use stethoscopes to listen to their heartbeat. We did Zumba, so all about movement and healthiness. And it was just a lot of fun. Like it was health education, but in a fun way where everyone was dancing, laughing, having a good time, playing different. We had some different like activity games. It was a great time all around. And the Avant volunteers that came out were our nurses, our scholars, even our corporate staff were there, and it was just such a heartwarming event.
With the hand hygiene, you there was glitter involved, right?
Yes,
You said. Now I
yes.
feel like any activity where glitter is involved, you don't forget easily because that glitter goes home with you. I mean, but I guess the whole concept around the glitter was like, if the glitter's gone, your hands are clean. Is that correct? Is that what that exercise was kind of about?
Yeah, it was like learning how the proper techniques to really wash your hands in the right way. And so with the glitter, you had to get the glitter off of your hands, which was kind of a fun game in itself, but also taught like
Yeah.
if you just kind of rinse your hands underwater, you're missing a lot of germs. And so it was a
Yep.
fun way to illustrate that. And glitter, I think, makes everything better. So it was
Yeah.
fun.
Yeah. I mean, anything with glitter, then then like it's a fun time. I feel like glitter
Absolutely.
is a ride along with a good fun time. So yeah, you told me about that, and I was like, oh, okay, I totally get that, and I can actually again see the implementation of that fun activity into a just a real tangible takeaway, right? Like I imagine that's kind of something that then those kids, I say kids because there's a wide range, but kids to teenagers to young adults, they probably, they won't forget that for a while. Like that's something that I think probably makes an impression.
Yeah, I think so. I think so. Glitter is it definitely stays with you, but they were able to get it off, and then the reward obviously was once your hands are clean. Now we're all going to have Jollibee, which was a hit. You got to have
Well,
Jollibee.
that in itself is enough prize, is a prize to absolutely clean your hands and get free of glitter. But so those are two, I mean, pretty major, big undertakings, but
Yeah,
that is not all
we're
that
not stopping
global
there.
impact is done, right? Yeah. But wait, there's more. Um, there was you did a medical and then also like a dental mission. Now, were these combined? Was it
Combined.
medical plus dental in one, or were they separate?
It was all together. You could have both your medical and your dental all
Wow.
together. This was in Cebu, which is another part of the Philippines, and we worked with an amazing organization called Everlasting Hope Childhood Cancer Mission. So they provide housing, support, resources to families and who have a child who is going through cancer treatments. And so the work they do there is just so amazing. And the medical dental mission was all about caring for the caregivers. So if you imagine the families who are dealing with such a difficult diagnosis, having their child go through such a difficult journey, um, they're there for everything, all the treatments, all the care, and they often neglect themselves in the process because they're so focused on caring for their child that's going through cancer. And so this medical dental mission was all about caring for the caregiver. So we were focusing on the family, so the parents, the siblings, the aunties, everyone who is involved in the care of the child who's part of Everlasting Hope was invited. Dozens of people were there. We had huge teams of doctors, dentists, nurses who were able to provide these medical services.
I mean, these are all very moving and impactful, but
Hmm.
this one particularly, really for me, struck deep because you think about what this organization is doing, and it's very similar to. There's a lot of other organizations that do this throughout the world, but I think that's kind of part of the point. Is like you look at even in like the United States, the facilities like that help uh, those parents and families when they don't have the resources to care for their sick child. We have that in the United States, right? And so there's absolutely a need for that worldwide, and this got even all the more personal because and this was something that I don't make a big to do out of it, as it were. But I had shared with you that I myself am a childhood cancer
Hmm.
survivor, and I saw the um, the toll it takes toll on families and on the
Absolutely.
direct caregivers and parents. And I think it is absolutely something that the parents and again the family and by extension the siblings, right?
Hmm.
In that care, it caring for a sick child is it is exhausting, and it's very
Hmm.
easy for these caregivers to neglect themselves, ironically,
Hmm.
in trying to take care of their sick child. So, being able to provide these health screenings and dental services and things like that, for those people, I just think it was, for global impact, just such a thoughtful, um, and really impactful initiative, that touches on, just the whole holistic approach of healthcare, right?
Hmm.
That the ripple effect, if you will, that, when someone is sick, that it can have, and the impact, no pun intended, that global impact can have. Can it touch not only, the children or the adults, that kind of thing, their health, but thinking about being very thoughtful and intentional of addressing the caregivers also.
Well, I appreciate that, Ross, and I thank you so much for sharing part of your story with me and also with the listeners. Um, you know, obviously, it's personal for you, and I think for so many of us, we either from our own personal experience or someone that we know in our life has had a child that's dealt with such a difficult diagnosis, and just to be able to come alongside families and let them know, hey, you're not walking this journey alone. We see you. We're here to support you. I think it makes a difference. And Everlasting Hope does this day in and day out with the work they do, and being able to come alongside and provide these services and be able to support this medical and dental mission was, I think, really rewarding. But just for everyone involved, it was a beautiful day. There wasn't sadness that day. It was really all about community coming together. We had a good time, and we're able to help people meet their healthcare needs, which was awesome.
Yeah, and I think, I mean, I even think back to, my own situation with my mom, and I know it was impactful when there would be parents, of, uh, children who were either cured or, in a better, had improved, that kind of thing. It goes a long way, to be able to bring together those communities, in a really, meaningful way. And I think this just gets back into, you know, the why, right? Why do we do global impact, right? Because healthcare is borderless, right? It's truly global, right? Um, is I have to believe that's just a big motivator for you also as leading this initiative, like the why behind the global impact.
Yeah, I mean, for me, I feel so lucky to get to come into work and get to do this day in and day out. Like, I feel so lucky for that. And it is rewarding to me personally. It fills my cup. It makes me really look forward to each and every day being able to make an impact. But even more than that, I think Avant is really investing in people. And I think when you show people, whether here or in another country or another community, that you care and you're coming alongside organizations that are deeply embedded in this work and who are making a difference, I think it encourages people. If you're involved in these nonprofits, it's hard work. They do hard work day in and day out, and they often don't have the resources that they need to really execute on their amazing vision. And so being able to come in and give support to that and being able to help them go further, be able to help them accomplish the vision that they have, I think that's amazing to be able to be part of. And also, being able to make a difference in people's lives, whether that's through our volunteers who come out and give their Saturday or give whatever day it is. They could be doing a million other things, but they choose to come together as a community to give back. And I think that speaks such volumes to our Avant volunteers, to our nurses, to our scholars who come out and choose to invest their time and to make a difference. It really takes all of us coming together to be able to make an impact.
So many amazing initiatives, so many lives touched in 2025. what what's next? What's happening in 2026? And I'm sure so many of these things are in the works, but you know, what's in store for the next year of global impact?
I am so excited for what the future has in store with Global Impact. We've got more scholarships, we've got more community programs, more, a bigger impact, more volunteers coming together. I can't give away all the details, but I'm sure, I hope you'll invite me back. We can talk through all the things that we've done. But really, the goal is bringing people together, our volunteers, our communities, to make an impact. So we're absolutely going to continue that in 2026.
Yeah, and so for those of you who are interested in keeping up with global impact, I highly, highly recommend you go to avanthealthcare.com/global impact. You can learn about these stories we talked about today, other stories, the impact that we're making. You can also sign up for our email newsletter to stay updated as far as the goings-ons of global impact. So really think you should go there. Again, avanthealthcare.com/global impact. And of course, I'm having you back, Christina. You and I are doing this song and dance like every quarter because you're doing amazing, amazing things with global impact. And I know that while this is your initiative, I know you don't do it alone. And I know there's many, many people, both
Absolutely.
behind the scenes, our own Avant nurses and volunteers and organizations abroad. So for those of you who may even be listening or watching, thank you also for being a part of our Global Impact Initiative. We really, really are working hard to change more lives and really make that healthcare impact. Is there anything else you'd like to add, Christina, before we say goodbye until next update?
I think it's always good to start and end with gratitude. So I also want to echo the thanks to all of the volunteers that have come out to any of our initiatives, whether they were medical camps in Kenya or the things we did in Philippines, that gave their time, gave their heart, gave their talent, is what makes this possible. And to the amazing organizations that we work with around the world. And Ross, thanks for having me on. It's always a pleasure. It's always fun to talk with you and to share all that we've got going on with Global Impact. So I just want to give gratitude there.
Thank you so much. If this is your first episode of Healthcare Heartbeat, please like, comment, subscribe wherever you are. And until next time, thanks for listening, and we'll see you.
Thanks for listening. This has been Healthcare Heartbeat by Avant Healthcare Professionals, the leader in international healthcare staffing and recruitment, where we change the lives of healthcare professionals every day. Make sure to follow us on social media and subscribe to this podcast for new episodes on Spotify, Apple Podcasts, or wherever you get your podcasts. See you next time.